Hi Merseycare, my name is Sidney Dekker. I work as a professor at Griffith University in Australia. The purpose of today is to try to get leadership at many levels in the organization interested and calibrated about the issue of just culture. How do we shift the conversation internally in Merseycare from one about rules and violations and consequences to one of trust and confidence in each other and hurts and needs and obligations and learning? That's the shift we're trying to make. Let's take ourselves to the ward. Dark and stormy night, right? Lots of pressure. You're there alone or with just a few colleagues, and there's lots of work to be done, and something untoward happens. What does a just culture mean to a person in that situation? What it means is the reassurance that the organization has their back, that the organization won't be there out to get them if there's evidence of something untoward coming forth. What I've seen in the past in other organizations does chime with what I hear about how you used to respond to things in this organization before. What encourages me, though, is, and that I think what matters more, is that there is definitely a shift and a transition already going on and a momentum building for that, a thirst for doing it differently. When it comes to mental health issues, there are often, of course, very rigid and strict processes and procedures to follow. Now, that doesn't necessarily clash with anything that I've been saying in terms of doing safety differently and thinking about more open-mindedness and a more openness to ideas from the bottom up. In fact, what we've seen in other organizations is that the more you make people owner of the rules and the processes and the procedures that you want them to follow, the more compliance you get, because they own it. They have helped create it. This idea that if we have a restorative system, if we have this more collegial and humane conversation with each other, we will invite people to blame the system and not take responsibility. I have no single shred of evidence that that is a risk at all. To them, ultimately, I hope, it would mean that they know that they go to a healthcare system that is willing to learn from the things that go well and the things that don't go so well. That they go to a healthcare system where colleagues trust each other, have confidence in each other. That they go to a healthcare system where they too, as patients, as service users, have a voice that is legitimated, have someone who listens to them, have an organization that understands that they are really the reason why the organization exists.